Case readouts for pneumothorax. A single view of the chest demonstrates a pulmonary nodule in the left upper lobe. The patient is status post lung biopsy, and there is a post-biopsy left apical pneumothorax. Otherwise, the lungs are clear, no more cardiomediastinal contour, and unremarkable osseous structures. So if you look at this in detail, you recognize that the lung markings go out with this sharp line, and beyond the line there are no lung markings. You can see only the ribs and the medullary space in the ribs, but not the lung markings. So this is a left apical pneumothorax. Single view of the chest on a neonate. There's an endotracheal tube terminating at the carina. The umbilical venous catheter terminates in the right atrium. No more cardiothomic contour for the patient's age. There's a small right pneumothorax, which is most notable along the mediastinal contours and also within the interlobar fissure. There is diffuse fine granular opacities of the lungs consistent with RDS, no pleural effusion, and unremarkable osseous structures. So what you need to note here is the patient is lying on her back. Therefore, the pneumothorax is going to be at the most non-dependent portion of the lungs, which is in this case anteriorly along the sternum and anterior chest wall. Hence, the pneumothorax is going to outline the mediastinal contours and not the lung apices. Single view chest radiograph demonstrates cardiomegaly. There is atherosclerotic disease of the thoracic aorta. 3-lead pacemaker is in place with the leads terminating in the right atrium, the right ventricle, and also within the coronary sinus. Diffuse interstitial thickening throughout the lungs consistent with interstitial edema. There is no pleural effusion. There is a small right apical pneumothorax. There is no pneumothorax on the left side, and the osseous structures are remarkable. This chest radiograph demonstrates a mimicker of pneumothorax. This patient has multiple skin folds projecting over the right hemithorax. You can see that these extend beyond the contours of the right lung, therefore do not represent pneumothoraces, and you can also see that the lung markings extend beyond the linear lucencies projecting over the right hemithorax. So these are skin folds, not pneumothorax.